So how about diagnosing HCV infection? There are two important tests to do, as I mentioned. One is for the antibody against HCV. The other is to test for the virus, which is the RNA. So the antibody, if it's positive, it shows you were infected at some time. Doesn't mean that you have it now. If it's negative and somehow you were exposed to needles or something in the last 6 months, you probably need to do it again because it might have been too early for you to make antibodies. However, when you are concerned and they have a positive HCV antibody test, you've got to do the RNA test to see if they still have the virus in their blood. And unfortunately, if somebody's immunocompromised on cancer chemotherapy, you can't be too sure if they're making antibodies, so you have to do the RNA for those folks. So this sort of shows you the schematic where if you have the antibody and the test is negative, you can go down that left-hand side and you stop. If it's reactive, then you go on to get the RNA, and then on the left-hand side, you don't have the RNA, and you're not so worried about it being a false negative or too early to pick up the virus, and so you probably stop there too. The real worrisome group is when you find the virus. That means you've got infection right now.